Friends, today we will discuss about how to approach chest X-ray in part 2. I have already discussed in part 1 about history, that is why, when, where and whose. In this section we will discuss about R, I, P. R for rotation, I for inspiration, P for penetration. Let us discuss about rotation. How to know your X-ray is rotated or not. That means what is the criteria for rotated X-ray or abnormal X-ray. In this case you will go for a fresh one. And what is the criteria for normal or a non-rotated X-ray. Let us discuss how to differentiate between rotated and non-rotated X-ray. The criteria for normal or non-rotated X-ray are: patient should be straight to the film during exposure. Remember again, you should keep the patient straight to the film during exposure. Second, head of both clavicles should be at the equal level and equidistant from the spinous process of vertebra. On the other side, the rotated X-ray arises when patient position is slightly rotated during exposure. Second, head of the both clavicle are not at equal level and they are not equidistant from the spinous process of vertebra. That's why it falsely diagnoses trachea deviated and cardiomegaly present. In this case, you will ask for a fresh one. Let us discuss what is the criteria for normal or non-rotated X-ray. In non-rotated X-ray, head of the both clavicles should be at the equal level and equidistant from the spinous process of vertebra. Let us discuss how to diagnose or recognize a rotated X-ray. In rotated X-ray, you should ask for a fresh one. In rotated X-ray, both heads of the clavicle are not at equal level and both are not equidistant from the spinous process of vertebra. One head of the clavicle is at higher level and another head of the clavicle is at lower level. As rotated X-ray falsely recognizes cardiomegaly present and falsely recognizes trachea deviated, in this case, you will ask for a fresh one. So by getting a X-ray film, you should observe both the clavicular head are at equal level or not. Both the clavicular head are at equidistant from the spinous process of vertebra or not. If they are at equal level and equidistant from the spinous process, then it is a normal or a non-rotated X-ray. Look at the film. Where is the spinous process of thoracic vertebra present? You should make a imaginary line by joining the spinous process of thoracic vertebra. From this imaginary line, you should observe both the clavicular head are at equidistant or not. If both the clavicular heads are equidistant from this imaginary line and both are at equal level, then it is a normal or non-rotated X-ray. Otherwise, it is a rotated or abnormal X-ray. Look at the tracheal impression. It is just above the spinous process of vertebra. That is, it is at the midline. And look for the position of the carina where it is divided. Look also other soft tissue impressions and bony impressions on chest X-ray. Look at the imaginary line drawn by joining the spinous process of each thoracic vertebra. This X-ray is a rotated X-ray as both the clavicular head are not at equal level and both the clavicular head are not equidistant from this imaginary line. Again I am telling, you should make a imaginary line by joining spinous process of each thoracic vertebra, and you should observe both the clavicular head are at equidistant from this imaginary line or not. If both are not equidistant from this imaginary line, then it is a rotated X-ray. This X-ray is a rotated X-ray. So, you should ask a fresh one. Look at the slide. The patient is straight to the film. That's why you will get a normal or non-rotated X-ray. Due to patient is straight to the X-ray film, you are getting a normal or non-rotated X-ray. Look at the position of spinous process of each thoracic vertebra. You should make a imaginary line by joining spinous process of each thoracic vertebra. This slide shows in figure A and B, the patient is straight to the X-ray film. That's why you will get a non-rotated X-ray. In figure E and F, the patient is slightly rotated. That's why you will get a rotated X-ray, which is a abnormal X-ray. In this case, you should ask for a fresh one. Look at the position of the each clavicle and each clavicular head, how they are equidistant from the spinous process of thoracic vertebra. Look at the semantic diagram where both the clavicle are not at equal level and both the clavicular head are not equidistant from the imaginary line. So it is a rotated semantic diagram. It is a rotated X-ray as both the clavicular head are not equidistant from the imaginary line and both are not equal level. It is a non-rotated X-ray as both the clavicular head are at equidistant from the imaginary line and both are also at equal level. It is a rotated X-ray as both the clavicular head are not equidistant from the imaginary line and both are not at equal level. So you can tell it is a rotated X-ray or a non-rotated X-ray. You can imagine why left side is a rotated and right side is a non-rotated X-ray. Can you tell it is a rotated or non-rotated X-ray where both the clavicular head are not equidistant from the imaginary line and both are not at equal level? Imagine it is a rotated or non-rotated X-ray. Guess which is rotated and which is non-rotated X-ray. Imagine it is a rotated or non-rotated X-ray. Imagine it is a rotated or non-rotated X-ray. Now discuss about I, that is inspiration. Your X-ray plate is a inspiratory film or it is a expiratory film. If it is a expiratory one, ask for a fresh one. Let's discuss how to differentiate between inspiratory film and expiratory film. Look at the position of the diaphragm. Look at the position of the first rib, second rib, third rib, clavicle, diaphragm, and other bony impressions. How to count first, second, third rib. Look at the impressions of anterior and posterior ribs. Posterior ribs are more or less horizontal, but anterior ribs are more or less inclined in comparison to posterior ribs. Look at how to count posterior ribs from 1 to 11. As I have already told, posterior ribs are more or less horizontal and anterior ribs are inclined. Look at the bony impressions of clavicle, scapula, anterior and posterior ribs, thoracic vertebra, and other soft tissue impressions. Let's discuss. Your X-ray plate is a inspiratory one or it is a expiratory one. If 9th to 10th posterior ribs are visible above the diaphragm, then it is a inspiratory one. Otherwise, it is a expiratory film where it will falsely recognizes cardiomegaly, dilatation of the pulmonary artery, and lung opacity. Again, I am telling, in inspiratory film, 9th to 10th posterior ribs should be visible above the diaphragm. All chest X-rays should be taken in a inspiratory phase, that is with deep inspiration. Look at the slide. Left side chest X-ray PA view shows more than 9 number of posterior ribs are visible above the diaphragm. That's why it is an inspiratory film. That means it is taken during inspiration. On the right side, it is an expiratory one as less than 9 number of posterior ribs are visible above the diaphragm. To make a film inspiratory or expiratory, you have to count down how many number of posterior ribs are visible above the diaphragm. If 9 to 10 number of ribs are visible above the diaphragm, then it is a inspiratory film. If less than 9 number of ribs are visible above the diaphragm, then it is a expiratory one. In this case, you have to ask for a fresh one. It is an inspiratory film as more than 9 number of posterior ribs are visible above the diaphragm. Can you tell it is a inspiratory film or it is a expiratory one? As 10 posterior ribs are visible above the diaphragm, it is a inspiratory film. That means it is taken during deep inspiration with breath hold. Look at the expiratory and inspiratory film of an same person. On expiratory film, it is falsely recognizes cardiomegaly and different lung size with different lung densities. Imagine which is inspiratory film and which is expiratory film. Imagine which is inspiratory and which is expiratory one. Can you say it is a inspiratory or expiratory one? Expiratory film will falsely recognizes cardiomegaly and different lung size with different lung opacities. That's why you should ask for a fresh one with deep inspiration. Now we have to discuss how to recognize emphysema on chest X-ray. Clinically, the patient will present as difficulty in breathing, shortness of breath due to decreased oxygen saturation. Now we have to discuss what are the X-ray features of emphysema. First, more than 9 or all posterior ribs are visible above the diaphragm. Second, both lung are black or dark in color due to hyperinflated lungs or hyperlucent lung. Third, in lung parenchyma, bulla may be seen with its margin. Fourth, heart will be small and tubular, that is barrel or round shaped heart. Fifth, flattened diaphragm. Sixth, it is seen in smoker, old age and COPD patients. Look at the X-ray features of emphysema. More than 9 or all ribs are visible in this case with black and dark lung, flattened diaphragm with small tubular heart. These are the features of emphysema. Look at the emphysematous lung having loss of its bronchovascular marking. The lungs are long, dark or black in color. Look at the X-ray features of emphysema where all previous features with bulla with its margin seen. Look at the X-ray features where more than 9 or all ribs are visible above the diaphragm having flattened diaphragm, small tubular heart with black or dark lungs having loss of its bronchovascular markings. Look at the X-ray features where in lung parenchyma, bulla with its margins are clearly visible. Look at the X-ray where all 5 features of emphysema are seen. Look at the X-ray where all features of emphysema with bleps are clearly visible. Now discuss about P, that is penetration or exposure. How do you know your X-ray plate is properly exposed by X-ray beam or properly penetrated by X-ray beam? In the other word, you can say your X-ray plate is not overexposed, not underexposed. Now discuss about what is the criteria of normally or properly exposed X-ray film. The criteria is outlines of vertebral bodies should be just visible. Again I am telling outlines of vertebral bodies should be just visible. In overexposed film, film becomes more black. In underexposed film, film becomes more white. In overexposed or underexposed film, vertebral bodies are not clearly visible. That's why you should ask for a fresh one. Let us go with an example. Can you tell which is overexposed and which is underexposed film? In overexposed film, the film will be more black. In underexposed film, film will be more white. Let's go with more slides with underexposed and overexposed film. In this case, you will ask for a fresh one. Ideally or normally, film should not be rotated. Film should be taken with deep inspiration and breath hold. Film should be adequately penetrated or adequately exposed. Thank you. Thanks for watching.